Now, an NHS consultant has told Good Morning Britain patients are dying earlier than they should as a result of delays in receiving emergency care.
Almost 19,000 patients waited in A&E for 3 days last year, according to figures obtained by Channel 4's Dispatches. In the documentary, which airs tonight, a journalist goes undercover as a trainee healthcare assistant at Royal Shrewsbury Hospital.
And that journalist is here from Dispatches, Robbie Boyd, alongside Tim Hebditch, who has personal experience of what it is like to wait in A&E because his son, Daniel, had to wait 18 hours with an infection and symptoms of sepsis. And we can also speak to consultant in acute medicine, Dr. Tim Cooksley, joining us from Manchester, wearing what I presume indicates some scrubs which suggest you're about to go on shift, Dr. Cooksley.
Good morning, Susanna. That's right, indeed I am, absolutely.
Can I just ask you first then, you work in acute medicine, you very often work in A&E. As you're about to start your shift, what do you expect to find?
We will find this morning a number of patients who've been in the emergency department for a long time, up to 24 hours. Some of those patients will be older, with cancer, and undoubtedly some will be on the corridors this morning.
How long should they be waiting?
So the patient should be on our acute medical unit, and they should clearly only be in our emergency department for up to 4 hours. As you know, we've not hit that target since 2015, but we've now each year got a little worse. That we now find, as you know, tens of thousands of patients waiting 12 hours every month to get up to our wards, to our acute medical units. And the harm associated with that is increasing, and it really is intolerable. It really is now up to a level of national scandal, unfortunately.
So that's an experienced doctor who works in acute medicine. Robbie, you went in as an undercover reporter, as a healthcare assistant. You passed presumably all the right checks in order to do that. So you saw the crisis sort of as an outsider, really. What was the worst that you came across? We saw that poor elderly chap who had to urinate in front of everybody else on the ward.
Yeah, I mean, I think that was the kind of emotional aspect to it when you see the dignity that's lost, that this is someone who's lived life, has, you know, a family, works a job, and then suddenly they're reduced to having to kind of strip naked in front of 30 other people. That really got to me, as you can see in the footage. But in terms of other shocking things that I saw, there was really long wait times. We've spoken about, you know, up to 30 hours in a hard chair. If you are an elderly person, that is just really alarming.
And, in fact, even a suspected stroke case waiting 24 hours.
Yes. So there was somebody who was, you know, query stroke, so the potential stroke, and they were waiting for a day to be seen. We thought they'd been referred to medics because that's what we'd been told in our handover from the night team. And then we found out that the doctor had never actually referred her on. And so she was waiting. We were saying, don't worry, you're on a list, you're going to get there. She was never on a list. And I actually kind of raised it, ended up calling the medical doctors, and they said, yeah, we don't know who that is. Now, luckily, she did then get seen quite quickly because I alerted the nurse in charge, things happened. But as you'll see from the documentary, that's not always the case, and it doesn't always go so well.
I thought what was quite interesting is that you were undercover, you went in as an assistant, but your own training, you're only trained for 2 weeks. I mean, that gives you an example as well of how much under pressure they are. 2 weeks, training's what, 10 days if you take out the weekend and you're thrown straight into a ward, and sometimes left on your own, right?
Yeah, so I would say, in fairness, I thought the training was really good. I thought it was pretty thorough for what I am supposed to do, but that's with the idea that you're going to be shadowing someone full-time for 6 weeks. I think the training's enough if that was the case. But what we found is within 5 shifts, I was completely on my own, and then suddenly you're not well enough trained to be dealing with that situation because I don't know how to do certain things. So that was the issue, being left alone.
Yeah.
Just to point out that Shrewsbury and Telford Hospital Trust told us we are very sorry that our patients have experienced anything less than the quality care we strive for. Our trust is facing significant challenges with urgent and emergency care, and whilst they say they dispute some of the claims made in the Dispatches programme, they'll fully investigate all of them. So let's switch to a different experience, and that is as the parent of a patient. And Tim Hebditch, tell us about what happened to your son, Daniel. When was this and where?
Yes, Daniel's A&E journey lasted 48 hours, in fact, in total. Danny is a student at Kent University. He became ill on Wednesday, the 13th of March this year, with symptoms such as acute stomach pain, fever, digestive problems. He went to the urgent treatment centre in Canterbury at 6 p.m. He was there for 6 hours and then referred to the A&E department at William Harvey Hospital in Ashford. So got there at midnight, was seen by a doctor, and a decision to admit was made. Right. He then had to wait on a hard chair for a further 18 hours, so this is 24 hours on a chair in total. I was with him in this period, and we asked repeatedly for a trolley or a bed. Yeah. We were told we couldn't have one. I made a formal complaint whilst we were waiting, and I told the hospital that I'd gone to the press, which I had done, and having done that, we were then given a trolley, which was better environmentally, but actually things actually got worse from that point because the obs were being monitored, and I could see that he was deteriorating. Oh my goodness. And nothing was being done about it.
And you have worked in healthcare for a huge
for a long period of time.
So you are qualified to be able to look at what is happening. You see, I mean, there's lots of parents who have an instinct, but you actually have some experience.
Yes, I knew what was supposed to be happening. What can happen happens in a lot of hospitals, but wasn't happening in East Kent that day. So I could see he was deteriorating. His pulse reached 140. His temperature was between 40 and 41 degrees. Organ failure starts at 42 degrees. He was hallucinating, and his CRP, which is a measure of inflammation, in a healthy person, it's 10. In Danny, it was 190. And nobody was coming. Nobody was raising a doctor. I had to start shouting, literally, about sepsis and demanding that a doctor came before one came. Consultant came 30 hours after he had last seen a consultant, and then treatment for sepsis was started. Things then improved. So after a 24-hour period on a trolley, he then went to a ward, and then it was 6 days before he got seen by a specialty doctor in the right setting. But that period of deterioration, I honestly thought he was going to die of neglect in front of me, and I can't describe the panic that causes.
I can feel it. We know is how that feels.
I'd also like to mention the hospital has had 100 days to get in contact with Danny and express any kind of regret about what has happened. They have not done so. They have been in possession of a formal complaint since the 15th of March, which came from Rosie Duffield MP's office. They have done nothing with that, and I think it's disgusting.
I can see how emotional this is for you. I mean, honestly, I don't know. I am at a loss. Let me tell you what, because we got in touch with the hospital. So a spokesman for East Kent Hospital said, "We are sorry that Mr. Hebditch had to wait longer than we would have liked for him to be admitted to a ward. Our dedicated staff work incredibly hard to provide the best possible care and regularly review patients who are waiting in A&E."
Yeah, I think if they're sorry, they could apologise to Danny.
Yes.
Which they've got ample opportunity to do. They can contact me, I will give them his contact details, and they can apologise to him, not to a press statement.
Let's talk to Dr. Tim Cooksley. I mean, you can hear, Dr. Cooksley, the pain in a parent's voice, somebody who knew what they were doing, who was able to step in on behalf of their son. Not everyone can do that. What is going wrong?
Quite simply, Susanna, and I'm so sorry for Tim's experience with his son in hospital. It's an experience that far too many people are having at the second, and staff on the front line are having to apologise every day for giving suboptimal care, and this is another tragic example of that. Unfortunately, demand is outstripping capacity. There are simply too many people needing care, and we don't have the resource and the capacity to provide the care that we need to give. And sadly, as simple as that, the system is overcrowded. there is insufficient capacity. This is leading to people waiting very long times in the emergency department, waiting very long times in acute medical units, and having significant delays to treatment, which is causing early death in some and harm in others. And that's physical harm and psychological harm, as you can hear from Tim's son's story.
Tim Cooksley, we're running out of time, but very, very quickly, what would you say to people? Because what you don't want is this story to put people off. If they have got any kind of health concerns, we've got a heat wave kicking in on Wednesday, and you've said as well before that a heat wave can be one of those things that puts lots of pressure on hospitals. However, we are going to be in that situation in 3 days. What would your advice be to people who are suffering in any way at the moment, or with the forthcoming heat wave?
You're absolutely right, and that's always the concern with raising concerns like this, is that it does then put people who are critically ill off seeking emergency care, and we are still striving to provide care for the sickest patients, and delays in treatment cause harm. So we don't want people not attending, calling 999, attending their GP, attending the same-day emergency care units. People need help, and we're still striving to provide that. So we don't want people to be put off. But this is a national emergency. There is chaos in our urgent and emergency care systems. The upcoming heat wave will put extra pressure on. And because the system is already overcrowded and there is insufficient capacity, there is no flex to deal with that strain. But we'll continue to work as hard as we can to keep as many people as safe as we possibly can. But this really is now a national scandal and a national emergency, and it does need urgent attention.
Tim Cooksley, thank you so much for joining us, and we've heard you loud and clear, a consultant in acute medicine. And thank you as well, Tim, and we give our wishes to Daniel, and we hope he does hear from the hospital very soon. And Robbie, a superb documentary. We look forward to watching that tonight on Channel 4. Thanks both for joining us.
If you're affected by any of those issues that we've been discussing, you can find advice and support at itv.com/helplines. And we will put all of those points to Wes Streeting, who is bidding to be in charge of the health service come the general election.